The silent signs of a heart attack you are ignoring. It probably won't start with a dramatic collapse. There's no crushing chest pain like the kind you see in the movies. Instead, it might begin with a feeling you've had 100 times. A little indigestion after a heavy meal, the exhaustion from a long week, maybe a strained muscle in your back. But this time, it's different. This time, it could be a heart attack, and you might not even know it. Research shows that around 45% of all heart attacks are silent, causing no obvious symptoms, yet they are just as life-threatening. A 2024 report from the American Heart Association estimates that about 170,000 silent heart attacks occur each year in the U.S. alone. These are people who have a heart attack without ever realizing their life is in danger. They mistake a deadly warning for a minor inconvenience, and that mistake could be their last. The damage being done to the heart is real and permanent. When we think heart attack, we picture that sudden, severe chest pain, but a silent myocardial infarction, or SMI, doesn't play by those rules. Its symptoms are masters of disguise, mimicking everyday ailments you'd probably just ignore. One of the most common and overlooked signs is a deep, draining fatigue. This isn't just feeling tired, it's an unusual or unexplained exhaustion that sleep doesn't fix. It might feel like the flu, but it can linger for days. Women, especially, often report experiencing this overwhelming fatigue in the days or even weeks leading up to a heart attack. Then there's discomfort that feels nothing like the classic elephant on the chest. It might feel a mild pressure, tightness, or a feeling of fullness in the center of your chest that comes and goes. Many people describe it as feeling like a strained muscle or bad heartburn. This discomfort can also pop up in the most unexpected places, a dull ache in your back, neck, jaw, or even your teeth. Other subtle clues? Shortness of breath with very little physical effort, or even while you're at rest. You might feel lightheaded, dizzy, or break out in a cold sweat for no apparent reason. Nausea and indigestion that aren't connected to something you ate are also frequently reported, particularly by women. Because these symptoms are so vague, it's easy to dismiss them as anxiety, stress, or just a normal part of getting older. While a silent heart attack can happen to anyone, some groups are much more vulnerable. People with diabetes are at a significantly higher risk. Over time, high blood sugar can damage the very nerves that send pain signals from the heart, essentially muting the body's alarm system. This is why someone with diabetes might not feel the intense chest pain of a classic heart attack. The risk also goes up as we age, so adults over 65 are more susceptible. As we get older, our sensitivity to pain can decrease, making it easier to miss the subtle signs. Women are another high-risk group, not because they are more prone to heart disease overall, but because their symptoms are more likely to be atypical. They often have shortness of breath, nausea, and back or jaw pain instead of chest pain, which can lead to a misdiagnosis or a dangerous delay in seeking treatment. And of course, the standard risk factors for any heart attack apply here. High blood pressure, high cholesterol, smoking, family history of heart disease, and not getting enough physical activity all increase your chances. Having a previous heart attack, even a silent one, dramatically increases your risk for another. If any of this sounds a little too familiar, it's time to listen to what your body is telling you. Don't just brush off recurring, unexplained symptoms. Share this video with your loved ones, especially if they fall into one of these high-risk groups. It could be the conversation that saves a life. And if you're experiencing symptoms that just feel off, even if they seem mild, please talk to a healthcare professional. The word silent is dangerously misleading. It only refers to the lack of classic symptoms, not the lack of damage. A silent heart attack is a major medical event that causes permanent scarring and weakening of the heart muscle. Once those heart cells die, they're gone for good. This damage seriously increases your risk for life-threatening problems down the road. Studies show that having a silent heart attack is associated with a 35% increased risk of developing heart failure later on. It also raises your risk of having another, potentially more severe heart attack or stroke. In the long term, the mortality rate for those who've had a silent heart attack is just as high as for those who had a recognized one. Often, the damage is only discovered by accident, months or years later during a routine EKG. By then, the opportunity for early intervention has been lost. The most dangerous thing about a silent heart attack isn't just the heart muscle it destroys, but the false sense of security it creates. That nagging indigestion, that persistent fatigue, that ache in your shoulder. These could be the whispers of a potentially fatal problem. Ignoring them is a gamble you can't afford to take. Knowing these subtle signs is your first and best defense. It's about tuning into your body and taking action when something doesn't feel right, even if it's not loud and dramatic. Don't wait for a scream when a whisper is trying to warn you. Pay attention, get checked, and take control of your heart health today.